health crisis, as dean of the college, I did not hesitate. It's like, yes, indeed. So I do want to acknowledge the director of the Division of Mental Health and the staff that we have worked with, and also the staff of the Crisis Hub in planning today's event, but more importantly, for the kind of work that we have been developing over the last couple of years. Many, many thanks to all of our presenters today. And I'm finally slowing down, but my minutes are up. It's like many, many thanks to our presenters, but to all of you who accepted the invitation to participate in this type of dialogue and discussion. Now, I took a public speaking class in college, but, you might not be able to tell it now given my excitement, but I really learned public speaking in church, wherein if there was a visiting dignitary, the person who was at the podium would say, well, without further ado, I'm now going to pass it on to, whoever it was. And so without further ado, I will slow down and I'm going to pass the mic. Good morning again and welcome.
Welcome to the stage, Dr. David Albert, Director of Illinois Department of Human Services, Division of Mental Health.
Good morning, everybody. I do have to say it's exciting to have walk-up music, and it's unusual, and I love it. Good to see, it's great actually to see everybody, so many familiar faces from here and from afar. My name's David Albert. I have the honor of serving as the Director of the Illinois Department of Human Services, Division of Mental Health. And it is my true pleasure today to welcome you all to the Illinois Behavioral Health Crisis Continuum Forum that's being convened by our academic partner, the Behavioral Health Crisis Hub at the UIC Jane Addams College of Social Work's Center for Social Policy and Research. And I'd really like to start by thanking Dean Hairston for hosting us today and for handing off the mic to me, and to Dr. Lorrie Jones. Lorrie, where are you? Lorrie, really, let's give Dr. Jones a round of applause. And the entire Behavioral Health Crisis Hub staff, really, for bringing together thought leaders from around the country to share their expertise. I'd like to give a special shout out to our partners in this work, in this room, the innovators and early adopters in Illinois who are going above and beyond to make sure that high quality crisis continuum services are available to all those who need them in our state. The Division of Mental Health has been working diligently to invest in and expand the behavioral health crisis continuum in Illinois through the funding of mobile crisis response teams, 988 suicide and crisis lifeline call centers, and living room programs. In addition, together with other state partners, we're actively evaluating additional behavioral health initiatives, which we'll be talking about today, including crisis stabilization units. A major focus of this effort has been through interagency collaborations with our state agency and federal partners, and with behavioral health providers and advocates across the state. Together, we are working to ensure that every Illinoisan experiencing a behavioral health crisis has someone to call, someone to respond to them, and somewhere to go during, and this is really important, after their crisis. While the transition to the 988 Suicide and Crisis Lifeline back in 2022 has been a catalyst for crisis expansion across the United States, Illinois has been in a unique position as the result of the Community Emergency Services and Supports Act, also known as the Stefan Edward Watts Act, which will ensure appropriate coordination between our state's broader first responder system and the someone to respond pillar of our behavioral health crisis continuum. We are grateful to Senator Robert Peters and Representative Kelly Cassidy for their passionate and dedicated advocacy for this legislation. DMH is also deeply appreciative of the close partnership with the Illinois Department of Public Health, the statewide 911 Administrator's Office, and the many appointed members of the CESA Statewide Advisory Committee and Regional Advisory Committees who have and continue to invest many, many hours in this important work. And I see many members of these committees in the room, and I thank you deeply. With all this in mind, I want to give special thanks to Illinois' Chief Behavioral Health Officer, David T. Jones, our Children's Behavioral Health Transformation Chief, Dr. Dana Weiner, our colleagues at Healthcare and Family Services and the Office of Medicaid Innovation, Senator Laura Fine, Representatives Lindsay LaPointe, Will Guzzardi, and other very engaged members of the General Assembly, the City of Chicago, and the entire crisis team for all of the amazing work that's gotten us to where we are today, and it will make Illinois an example for the rest of the nation. And we really are becoming an example for the rest of the nation. It's something we should all be very proud of. The Behavioral Health Crisis Hub has created a thought-provoking day that is designed to get us thinking about how we can further improve the Illinois behavioral health crisis continuum. So let's together be open to exploring new ideas, to embracing innovation, and as we leave here today, to take action and to move forward. Thank you and enjoy the day. And with no further ado, I'm going to hand things off to Kristine Herman from HFS. Thanks.
Please welcome Kristine Herman, Chief of the Bureau of Behavioral Health, Illinois Department of Health and Family Services.
The only thing that makes me sad is that I didn't get to choose my walk-up music. Y'all can vote about what you think that might have been. So as that amazing voice said, I'm Kristine Herman. I'm Chief of the Behavioral Health Bureau for Illinois' Medicaid State Agency. That's Healthcare and Family Services. And on behalf of the entire Healthcare and Family Services Administration, I would also like to extend a very warm welcome to all of our distinguished guests and a special thanks to the Behavioral Health Crisis Hub for the immense amount of work that they completed in a very short period of time to bring this crisis forum to fruition. Now, this forum represents the continued commitment of Illinois' state agencies to bring all of our resources together to establish a first-in-class, unified crisis continuum, capable of providing crisis support, crisis response, crisis stabilization, and most importantly, connection to supported services for all individuals in Illinois. Now, under the leadership of our Chief Behavioral Health Officer, David T. Jones, HFS has had the privilege of working intensively with our partners at the Division of Mental Health and the Division of Substance Use Prevention and Recovery to craft the vision and the blueprint for establishing the unified crisis continuum. Led by Chief Jones, the agencies, along with key provider partners, have mapped our current crisis system. We have outlined areas for improvement and enhancements, and we are progressing toward a detailed implementation plan to take our crisis continuum to the next level. Now, Chief Jones is going to be offering a much more detailed overview of this process during his panel presentation today, so I'll make a shameless plug for you all to attend that session to hear a lot more about that really exciting work. And I'm also very excited to announce that this partnership has resulted in more than visions and blueprints and plans. There have been real, tangible results as well. So utilizing our incredibly strong interagency collaboration and including input from key provider partners, some of you here today, Illinois applied for and was recently notified that we will be participating in the Federal Certified Community Behavioral Health Clinic Demonstration Initiative. So we are very, very excited. So through this federal demonstration, HFS will recognize 19 certified community behavioral health clinic locations throughout Illinois. They'll be providing mental health, substance use recovery, and physical health screening services for anyone in their area that needs those services. These CCBHCs will also be providing mobile crisis response, crisis urgent care, and as you heard previously, crisis stabilization units. This represents an immense step forward for the crisis continuum and for fully integrated behavioral health care. This initiative clearly represents the powerful impacts that are possible through meaningful and ongoing collaboration. So as we move forward with the exceptional programming ahead of us today, let's keep in mind what mountains we can move with innovative thinking, with strong partnerships, and with shared determination to offer our customers a first-in-class experience at times in their lives when they need it the most. Now, without further ado, I will bring up a dignitary to the stage, Dr. Lorrie Jones.
Welcome to the stage, Dr. Lorrie Jones, Director of the Behavioral Health Crisis Hub, Jane Addams Center of Social Policy and Research.
Good morning, Illinoisans. I was less worried about the music and more worried about getting up those stairs with heels, but I made it. And as that voice said, I am the director of the UIC Crisis Hub at the Jane Addams College of Social Work, and I would like to thank my colleagues for their welcoming remarks. Dean Hairston, my dean, Director Albert, Chief Herman, thank you all for being here. It means a lot. I would also like to personally thank our sponsor, Division of Mental Health, Director Albert, and Deputy Director Reinert. Where is she? Somewhere. Thank you for being amazing partners. And our speakers who traveled near and far to share their expertise today. What an incredible gift. I am deeply honored that you agreed to do this. And I would like to thank my team, the staff at the UIC Crisis Hub. Please wave, staff, be recognized for the extraordinary job that they did in record time to pull this together. So thank you so much. Our event planning partner, Wagner Lane, also did a fabulous job. Thank you so much. And finally, I want to thank all of you for participating in this meeting on the Behavioral Health Crisis Continuum. You are here because you have shown an extraordinary commitment to this work and are poised to take it to the next level. We have made significant strides over the past decades in improving our crisis care systems for persons with mental illnesses and their families, and it's important to recognize those accomplishments that we now want to build on. 911 has been answering calls since 1968, and the precursors to 988, the National Suicide Prevention Hotline, since 2005. Mobile crisis response teams, at least since the 1970s, and living rooms as a concept since the 1980s. But despite these accomplishments, we know that 2 million people experiencing a behavioral health crisis in the United States are arrested and booked into jails each year. 13.2 million are taken to hospital emergency rooms, some appropriately, others maybe not so. And nearly 50,000 commit suicide each year, and others lose their lives while in the midst of experiencing a crisis. Further, these individuals may enter these systems over and over again in a revolving door of insufficient or inadequate crisis responses. Our work is not done. We can do better, and we must do better. For me and for many of you, it's a moral imperative to change systems when people are treated differently because of the nature of their medical condition. It's a civil rights issue. No, it's a human rights issue. And so we must ask ourselves, why should persons experiencing a behavioral health crisis be treated differently than persons experiencing a heart attack or stroke? And in the words of our CESA partners, just like police are not appropriate caregivers, care providers for people experiencing a heart attack, police are not appropriate care providers for people experiencing a mental health crisis. And relatedly, why do we continue to expect our law enforcement partners without adequate educational background or training to assume the roles of clinician or social worker in situations that could best be handled by behavioral health experts? Why are persons experiencing behavioral health crisis often criminalized for low-level nuisance infractions as opposed to getting the care they need in the systems designed to serve them? And why do our systems of care release people from care systems, often prematurely, back into their communities without the full supports that they need to begin or to continue their recovery? I want these questions to be unsettling for you, to challenge your equanimity, your sense of fairness, and ultimately to inspire you to propel into action. And so the main goal of this conference is to not start a conversation. So many of you have spent decades in the trenches doing the good work that has brought us to where we are today. Instead, it's about elevating and advancing that conversation, sharing knowledge and learning, and ultimately propelling us into action. Action resulting in proliferating what we know works, propel us to redirecting care back to the systems designed to provide that care, propelling us to explore and innovate in our local communities so all in need can benefit from the best possible care when they are most in need. And so, now for the logistics for the day. We will start off the day with 2 plenaries, the first giving a national perspective on the crisis continuum, followed by an Illinois perspective. This is followed by breakouts, and you can look at your folders and get your agenda that each of you have already selected, one on community engagement, one on behavioral health workforce issues, and one on rural issues. Rural issues has been increasingly brought to our attention as an issue that we must grapple with and look at squarely in the face and be innovative about. Please check your agenda for the rooms, and there will be staff assisting you for the location of the breakouts. This is followed by lunch. Box lunches that you selected will be back in this room, I believe on this table. Your selection is printed on your badge, so please take what you selected and not make anybody else mad. They can't get what they wanted. At lunchtime, we're hosting what we call Lunch with the Experts. So our presenters from this morning will be at tables here in the front and being prepared to answer any additional questions you may have. And in the afternoon, we will have 3 plenaries. The first showcases mobile crisis response models from around the country that will be discussed by our national experts, followed by model programs and best practices in our own state that I'm really excited about. These sessions are followed by a presentation by national experts on a roadmap for creating these mobile response models, ranging from community engagement to financing and sustainability. We will wrap up the day with what we call a solution room, where our plenary speakers will come to the stage and dialogue and any final questions. And we will conclude our presentations at 5 o'clock. I invite you to join us for a reception from 5 to 6. We hope to keep as many speakers around so that you can network, grab their cards or whatever. We have snacks and refreshments you might have seen available all day outside to the left. There'll be charging stations and highboy tables for brief calls to the right. And your folders contain the following information: a copy of the forum agenda, speaker bios that you can reference, and the evaluation form. So we ask you to please complete the evaluation form throughout the day as you attend the presentations. There are boxes available at the entrance and exit to this room and the building, and one at the help desk to submit your completed evaluations. An electronic version is also available via QR code that you should see on your table. For those of you who are seeking CEUs, and many of you have requested CEUs, there are 6.4 hours of CEUs available for today's event. You must submit their evaluation using, again, the form or the QR code, and staff will be available to answer any questions about CEUs. Finally, take out your phones, everybody. We'll be engaging in an interactive process with you throughout the day using the Mentimeter app to gather questions for our plenary speakers who will participate in the solution room this afternoon, and a couple for mental health trivia questions. So we're going to select someone from the audience and ask you to participate in some mental health trivia questions. And the Mentimeter app is free to use and doesn't require you to log in. You can scan the QR code, or you can go to www.menti.com and type in the code 5210-8184. That's 5210-8184. So let's give it a go. Okay, so you've got the question. We want to know where you're from today. Where are you coming from? And we're watching this in real time. This is so cool, right? Okay. So, not unexpectedly, a lot from Chicago, but also nice numbers from across the state and outside Illinois. So thank you. Let's give yourselves a hand. Everybody knows how to use Mentimeter now. So remember, put your questions in after each of the plenaries. So thank you. And I think that, let me end with these remarks. Let us rise up with a greater readiness. Let us stand with a greater determination, and let us move on to make our crisis care system what it ought to be. So I hope you enjoy your day. We're going to have, a little break before we start our first plenary. Please help yourself to some breakfast, and we will start promptly at 9 a.m. So thank you.